Hi, my name is Abigail Wetzel, and the topic I decided to do for my final project was healthcare in England, the demographics, mortality, and system overview. Now, out of all the countries in the world, why did I select England's for their healthcare system? Well, I've had experience studying abroad in Europe as a freshman. I ended up going. So, let's talk a little bit about England's demographical population and cultural makeup. As I mentioned before, the cultural makeup is diverse. And all right, let's talk about the life expectancy and mortality in England. The life expectancy has been noticeably declining compared to previous years. Let's talk a little bit about life expectancy by ethnic groups. So, as mentioned before, life expectancy for males and females dropped. Now, here's a little bit of some statistical insight as well. I decided to do some research on the regions with the lowest and highest life expectancy. Now let's talk a little bit about England's mortality rates. So, as we mentioned prior, it shows concerning trends over the recent years and a lot of. All right, moving onward to go along with mortality, as I'm a nursing major, I wanted to talk about the common causes of death in England. Okay, so let's talk about the most treated illnesses in England. So, as mentioned before, there were cardiovascular diseases, so like ischemic heart disease. And moving forward, let's talk about England's healthcare system. The NHS is also known as the National Health Service. It was originally. All right, so let's talk about the structure of the NHS. So, the NHS is very complex, but it has undergone changes in the recent years. So, how is the healthcare system funded? Funding of the healthcare system is majorly from general taxation. However, the difference is from national insurance contributions and a small portion from co-payments and private payments. The DHSC receives a budget from the government and then distributes that to various parts of the healthcare system. Okay, who qualifies for public healthcare in England? So, as mentioned before, residents are entitled to free public health care through the NHS, and this includes citizens. These are the methods of healthcare delivery. There's hospitals for secondary and tertiary care, there's mental health services, there's community health services. So what takeaways can the US learn from England's healthcare system? Number one is universal coverage. So by having a whole scope of coverage for all the. So, our big takeaways from this presentation include England's demographic population is diverse, life expectancy has declined recently, and then here's some of my references. And then here are some more of the references as well. And with that, this concludes my final project presentation. Thanks for listening and thanks for watching.